So in terms of gynecology, I think some of the highlights were quite clearly the studies on dual checkpoint inhibition. One was presented by Dr. Dyson today, looking at a combination of Ipilimumab and Nivolumab in clear cell gynecologic cancers. It was mainly ovarian cancer, but there was also some endometrial and cervical cancers. It was a randomized study, but not comparative, but it was going to look at the overall response rates in both treatment arms. And you see clearly that if you give both, so anti-CTLA-4 and anti-PD-1, that you increase response rates to a level that I think could really leverage IO efficacy in ovarian cancer. Now, having said that, I have to admit that clear cell ovarian cancer is a different entity, and there's a strong rationale that maybe immunotherapy works better in these cancers, but there's also data for the combination in all-comer or all histology ovarian cancer, which points in a very, very similar direction. So this was one of the important studies. There's another study looking at a combination of Pembrolizumab with an anti-TIGIT antibody in mismatch repair-deficient endometrial cancer, which I thought was quite interesting because the response rate observed there was 65%, and what we've seen so far with single-agent Pembrolizumab or other PD-1 inhibitors in that setting was a response rate in the range between 45 and 50%. So I think this is quite encouraging, and I think one should move forward with these studies in earlier settings and maybe even combination with chemotherapy. And otherwise, there's a couple of other very important abstracts also in the range of breast cancer. Destiny Breast 06 was presented today, which I think is practice changing. So these were so far my take-home messages of the most important abstracts.